Have you got a little one who was born full term, but with extreme low birth weight? Are you worried about your baby and wondering how long you should wait for them to grow before you actually see a pediatric physiotherapist about their gross motor skills? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share with you 3 things that would indicate that your baby with extreme low birth weight would benefit from seeing a pediatric physiotherapist. So here at My Favourite Physio, we see lots of babies and toddlers, and our main aim is to help them move better. Recently, we met a little one who was 15 and a half months old, born full term, but with extreme low birth weight of 1.5 kilograms. His mother reported that she had been concerned about him for a while, but she was constantly told by her pediatrician and family doctor that he looks fine and he just needs time to grow. However, he is now 15 and a half months, and mom was extremely concerned because he wasn't saying any words. He was struggling with lumpy food and still needs a smooth puree diet. He's 15 and a half months and not yet crawling, and he is only now just started to hold his bottle. So as a result, she searched us and found us on Google. So we did a full assessment on this little one, and we found that he still continues to be way below the growth charts for his height, weight, and head circumference. And so it is quite easy for family doctors and pediatricians to look at him and think he looks fine because he is in proportion. But if you look at growth charts and he's way below the 3rd centile, he's actually really small for his age. So it can be quite misleading to feel that little one looks fine and they will just grow and be fine. When we actually do a full assessment, little one was only performing gross motor skills equivalent to an 8-month-old baby. That means this little one is delayed by at least half his chronological age, placing him at being moderately delayed in his gross motor skills. When we see him and realize he doesn't actually speak and he struggles with lumpy food, meaning he really has low muscle tone and weakness that stops him from chewing lumpy foods and swallowing with ease. As a result, we referred this little one for speech therapy, feeding therapy, dietitian, occupational therapy to help him with his development in fine motor skills, speech and language skills, and as well as feeding and weight gain. So if you are out there and you've got a little one who was born with extreme low birth weight, here are 3 things I would like you to keep an eye out for. If your little one is not growing on the growth charts, they're not catching up, and they still remain very low at the bottom of growth charts, below the 3rd centile, that is an alarm bell. Babies should be trying to grow in the 1st year, and this little one was just plateauing in his growth, making that gap between the other typically developed children and himself wider and wider as months went by. So the first thing to look out for is their growth charts, and are they tracking on growth? Number 2, are they speaking at 12 months old? Is there babbling? Is there mama? Is there at least some simple sounds? Are they able to tolerate lumpy food at 12 months old? If they're still struggling and only needing to have pureed diet, it means that they're struggling with chewing and swallowing, and so they do need someone to look at them, preferably a speech therapist who is a feeding therapist. The third thing to look out for is if your little one is not yet crawling at 12 months old, it is certainly worth speaking to a pediatric physiotherapist. So if you're concerned about your little one, why don't you ring us here at My Favorite Physio, speak to one of our expert pediatric physiotherapists. The number to ring is 02-9790-4233. And if you know somebody out there who has a baby who was born with extreme low birth weight, why don't you like and share this video with them? Until next time, have a fabulous day. Bye.